And do you see that health systems or hospitals will try and get a separate task force to tackle this, or with resources being so slim and margins being so slim, are they trying to just squeeze it out of people who have now three different day jobs to put this in order? Yeah.
So that's exactly what happened to me. I have to say, if I got paid for every title I had, I would have retired a long time ago. So it's like, give it to the busiest person, they'll get it done. So what I would, if in a perfect world, I would say to you, point someone at this is their job, no other job, right? But even then, you need to have other people as part of this task force, as you called it. You have to have a Section 1557 coordinator by November 2nd of this year appointed. So I fear that most hospitals are going to just make their risk manager or their patient advocate or something the Section 1557 compliance coordinator, right? You need to involve your legal and compliance teams because they need to provide guidance on regulatory requirements and ensure that we're adhering to it. Plus, when a patient files a complaint, they need to also be involved to make sure that there is an appropriate response to this, right? Clinical teams need to make sure that they understand the policies, the procedures, and then they incorporate that into the patient care workflows and some decision making processes that are also part of this. And then on top of it, don't forget the community. You've got to educate the community as well, because the more informed the community is, the less opportunity for something to fall through the cracks, right? So if the community understands that they have the right to an interpreter, then they would know what to ask for. It's kind of hard to ask for something that you don't know exists at that location. So all of the signage is going to hopefully help that. But then without our IT and data people, we would be lost, right? Because an organization should work towards getting their language service provider integrated into the electronic medical record. So, like for instance, AMN has several renditions of integrations into Epic, Meditech, and I think Cerner. Other companies have that as well, right? But it's so much easier that every time an interpretation is done, it's documented automatically into the electronic medical record. So it helps both the clinician with the burden of having to document more things, and it also helps from a risk and liability perspective because you have a tracking system of when and what you provided. So, that to me is, and don't just do a task force that's going to be like, oh, one and done, because this is going to remain in place.